Hello friends. Today we are going to talk about a very common disease which are called Gerd. Gerd is a short form of gastroesophageal reflux disease. So we will come to define what is Gerd. So it is a disease in which gastric contents comes reverse to esophagus. So when it's come, it produce gerds. Like you see in this shape, the gastric contents goes back to esophagus. Two important symptoms are available in this case. One of them is heartburn and another one is regurgitation. So anti-reflux mechanisms are three. Number one is lower esophageal sphincter. Number two is crural diaphragm. And the third one is peristaltic movement of esophagus. So now we come to the pathogenesis. First one, abnormality of lower esophageal sphincter. Normal tune of this sphincter is about 10 to 35 millimeter of mercury. If it becomes less than or decrease 10 millimeter of mercury, then problems begin. Reflux occurs when there is high intra-abdominal pressure due to pregnancy, tight clothing, truncal obesity, ascites, and etc. The second one is hiatal hernia. In 30% of cases, it occurs in older age, greater than 50 years. If hernia is big in size, then there will be severe chest pain. The third pathogenesis is delayed esophageal clearance. Due to decrease in peristaltic movement, it delays. Some disease like scleroderma, which is an autoimmune disease, can cause fibrosis. Sjogren's syndrome, it is also an autoimmune disease and affect salivary glands, and their function becomes loss or decrease. The third one is the fourth case is defective gastric emptying. There are two types like gastroparesis and partial gastric outlet obstruction. So we will come to talk about the fifth pathogenesis, which is increased intra-abdominal pressure. It is because of pregnancy, obesity, ascites, heavy meal, and etc. Sixth one is dietary and environmental factors, which are fatty meal, chocolate, cigarette, coffee, alcohol, nitrate using, anticholinergic drugs, beta-adrenergic drugs, aminophylline, calcium channel blocker, sildenafil, other like vomiting, inji-tube, scleroderma, sleeping just before eating or after eating. Clinical features. The first one is heartburn, which is called pyrosis. It occurs 30 to 60 minutes after eating. Increases with straining, forward tilting, and in lying position. And decreases with antacid, baking soda, and in sitting position. Pain is due to esophageal muscle spasm, which can be felt in neck, jaw, and at the back side. Other clinical features are regurgitation, water brush. Water brush, it is increase in saliva production. When acid goes to esophagus, in reflux salivary gland becomes more secretory in order to get rid of acid. The other feature is dysphagia. It occurs in 1/3 patient. It means 3 in 1. Because of erosive esophagitis, damaging of peristaltic movement and structure of esophagus, this case happens. There are some non-specific symptoms of Gerd like dyspepsia, asthma, chronic cough, laryngitis, hoarseness, sore throat, atypical chest pain, and sleep disturbances. Now we come to the diagnostic examination for Gerd. First one is upper endoscopy. It is for mucosal damage. The second is barium esophagography. It is for diagnosis of stricture if there is dysphagia. Third one is esophageal pH checking for acid reflux. The fourth one is combined esophageal pH impedance testing. It is for acidic and non-acidic reflux. The fifth one is esophageal manometry to check tune of esophageal sphincter. Now we come to the complication of Gerd. The first one is esophagitis. The second one is Barrett esophagus. It is a pre-malignant state when there is chronic reflux. It can be treated by long-term use of PPI. Surgery is the best way in this case, and it is called fundoplication. The third complication is benign esophageal stricture. It occurs in 10% of cases, mostly in older, greater than 60 years old people. At first, they have dysphagia and burning sensation, but if stricture becomes more and more, burning sensation won't be there because there won't be acid reflux anymore. Patient must do balloon dilatation and use of PPI. The fourth complication is anemia, especially IDA or iron deficiency anemia. The fifth one is gastric volvulus. In herniated patient, it occurs. Symptoms are dysphagia, severe chest pain, vomiting. It resolves itself, but surgery is done because of the reoccurring. The sixth complication is aspiration. At sleeping, stomach content reflux and goes to respiratory system. Symptoms include in aspiration, hoarseness due to edema of larynx, cough, lung fibrosis, and pneumonia. Now we come to the differential diagnosis. We can differentiate this disease with motor disorder of esophagus, peptic ulcer, angina pectoris, functional dyspepsia or dysphagia, drug-induced esophagitis, radiation esophagitis, infectious esophagitis. Now we come to the treatment. First one is for mild and intermittent symptoms like when GERD happens less than 1 week or once per week. The first thing we should care about is lifestyle modification. They include sleep approximately 3 hours after eating. When sleeping, pillow must be about 6 inches high. Release of intra-abdominal pressure. Refluxogenic meal should be avoided like tomatoes, citrus, coffee, fatty meal, anticholinergic drugs, and etc. The second treatment is medical treatment. In this case, we use antacids. Alliginated or alliginate antacids like Gaviscon 10 to 20 ml after meal and at night. The second one is mocaine, which consists of magnesium trisilicate and ammonium hydroxide, 5 to 10 ml 3 to 4 times per day. H2 receptor blockers like cimetidine 200 mg once daily, ranitidine 75 mg once daily, nizatidine 75 mg once daily, famotidine 10 mg once daily or once a day. Now we come through complication of GERD and its treatment like erosive esophagitis, Barrett esophagitis, and stricture. In this case, initial treatment is usage of PPI or proton pump inhibitor like omeprazole 20 mg, rabiprazole 20 mg, lansoprazole 30 mg, esomeprazole 40 mg, pantoprazole 40 mg, and dexlansoprazole 60 mg. They are used 30 minutes before meal once daily or Besendai or 2 times daily for 8 to 12 weeks. Long-term treatment after PPI stopping if GERD reoccurs in 1 year, especially in first 3 months. So we must take PPI in high doses like once daily or 2 times daily or maybe 3 times daily. 60% of people has functional heartburn. For them, tricyclic antidepressant like imipramine or nortriptyline orally can be at low doses can be used like 25 mg at sleeping time. Prokinetic agents metoclopramide can be used 10 mg 3 times per day or domperidone 3 times per day 30 minutes before meal. H. pylori eradication therapy. One of them is omeprazole 20 mg BID plus amoxicillin 1 gram BID plus clarithromycin 250 mg BID. Surgical treatment is fundoplication. If there is failure to treatment. As you see, this method is the fundus part of gastric. We stretch our stretches around the esophagus in order to make it tune more and more. So the normal picture you see, there is peristaltic movement of esophagus, there is crural diaphragm in space, there is lower esophageal sphincter, and there is normal clearance of the stomach. Now we come to the abnormal picture. You see that there is no peristaltic movement because of scleroderma, because of other disease, and there is hiatus hernia, and crural diaphragm is not working properly, and the lower esophageal sphincter is also displaced and not working properly, and maybe there is intra-abdominal pressure, and may there be non-clearance of stomach. Thanks a lot for watching.